Hi, everyone, and thank you for joining us today for this Facebook Live broadcast. I'm Allison Johnson from Windsor Regional Hospital, and today we're talking about the role of the caregiver. So with visitor restrictions in place and patients and staff not always able to see each other in person, families and loved ones are having to find new ways to stay connected. So we have a great panel of guests here today to talk to us about how to make the most of these virtual visits and how to stay connected in your loved one's care, even when you can't physically be there. So please join me and give a big thumbs up to our guests today. We have Jonathan Foster, who's the VP of Emergency Services and Mental Health here at Windsor Regional Hospital. He also led the team at the field hospital at the St. Clair Sports Flex during Wave 1, and back then is when we really started to use iPads to connect families. We also have Andrew Lombardo. He's a social worker here at Windsor Regional Hospital with a background in caregiving from afar. And he has some advice today to help keep everyone connected and make the most out of these virtual visits. Another couple that I want to introduce you to right now, and they know how important these visits are. Please a thumbs up for Heidi and Torry Robertson. Torry spent 5 months in the hospital recovering from COVID-19. And for much of this time, Heidi was unable to visit, and she had to rely on the care team to facilitate these visits. So thank you for joining us today, Heidi and Torry.
Thank you.
And finally, we also have Muir. She's the CEO at the Unemployed Help Center. The reason that we do these conversations, and one of the first people in the region diagnosed with COVID. Hello, June.
Hello, Allison.
And thank you, everybody, for joining us today. Thanks all of you for joining us today. And a bit of housekeeping off the top. This is Coping with COVID, a series of live conversations about COVID-19. And if you have any questions for our guests throughout this conversation today, please submit them in the comment section below so we can include them in today's discussion. So, Jonathan, let's start with you to set this conversation up for us today. First, I want to get you to talk about how important is the role of the caregiver for patients, and how has that role changed specifically when it comes to the family member?
Thanks, Allison, and thanks for having me on today. I think it goes without saying that the caregiver is an essential part of the team. When somebody's in the hospital or receiving healthcare, the caregiver, and caregiver is a really broad term. It can be a first-degree relative, it can be your best friend, it can be anybody who's really important to your health and well-being. Pre-COVID, we have always striven to include caregivers as much as we can in a person's plan of care, and especially as they transition to discharge. When COVID hit and we had to start to really limit people coming into the hospital for safety reasons and for public health restrictions, we had to really quickly rethink, how can we do this? How can we make this work? And you mentioned earlier in Wave 1, I worked out at our St. Clair campus at the field hospital. And that was the first time it really hit us how much of a barrier this was going to be and how meaningful it was to have that component of caregivers involved in social visits, but also planning through care and learning about people's health history. And we quickly turned to technology, and it was amazing how seamlessly it went. And I have to give a huge credit to our clinical teams and allied health teams who rose to the challenge in record time and quickly figured out how can we use technology, whether it's an iPad or a phone or an iPhone or any of the various video platforms, to connect people outside of the hospital with their loved ones inside of the hospital.
And I want to jump to Heidi and Torry now. Thanks again for being with us today.
Thanks for having us.
Heidi, I want to ask you, what was it like with Torry in the hospital, dealing with this illness, and you're not able to be there by his side? How were you able to stay connected and get updates on his progress?
Well, when he first went into the hospital, like before he went into the ICU, we were FaceTiming with his phone. He was very ill. It was just brief moments just because of how tired he was. And then, in fact, the nurse and Torry FaceTimed me together to let me know that he was going to the ICU to go on the ventilator because of his oxygen levels were so low. And then it all happened so fast. So he was, next thing I knew, this was all so new for me. And so next thing I knew, he was in the ICU, and I was just calling the nurses. And he was in the ICU for 7 weeks. So over time, I didn't FaceTime with him right away. I didn't know what to expect, what he looked like. I've never even really seen an ICU or know what it entails to be in the ICU. So it was just a very, very scary time. And then I started to like speak to him while he was still like in a induced coma over the phone. So the nurses were so kind and would take the phone and put it to his ear so I could speak to him. And I would three-way also with his children who live in the US. And we would pray with him, and because I believe that he could hear us. So, and then once he slowly started to come down on the ventilator settings and would give the odd thumbs up or things like that, they would, the nurses would also bring the iPad into the ICU room, which we only did a few times, only because at that time, like early on, they would have the iPad covered with plastic. Plus, it was so loud in the room that like Torry kind of wasn't really focusing his eyes or anything like that. So we would just talk to him and kind of put the iPad where he could see. But that's how, like at first, that's what we did to communicate with him. And then I early on when he went into the ICU, I went on Amazon and I ordered a teddy bear that has a recordable device in it where I could record a message. So I recorded a message on the teddy bear, and the hospital allowed me to drop it off. And so days when I couldn't call him, or like they couldn't put the phone to his ear or FaceTime wasn't available, because I think at that time there's only a few iPads going around. So it wasn't always available, but the teddy bear then would stay in his room on his bed with him, and the nurses, anytime they went in there, they would press the button and put the bear to his ear so that he was still getting my voice, getting my voice, like able to hear familiar voices. So that was like in the ICU. And then, yeah, I don't know if you want me to continue on. It's just such a long time in the hospital.
If you have more, I like your ideas so far. It's so important to, you have to be creative right now because you want to reach out and have that connection. And Torry, hearing this story, you've come a long way, obviously, from being on a ventilator in the ICU, and we're really happy to have you with us today. And I know that part of your recovery, you're not able to talk too loud or too much, but can I ask you, how important were those conversations, those FaceTimes, that teddy bear in your recovery?
He said they're very important to him.
No doubt. And how important were they to you, Heidi, to have those opportunities?
It was very important, and like, sorry if I get teared up, but when he was in the ICU, the nurses were so amazing because he didn't have his cell phone. I think it was in like with his belongings. So they would call me within the room, and they were totally garbed up with the PPE, and they always worked so hard to kind of like get messages across to him or put the phone to his ear, and I would talk, and they were so patient, like letting me, if I needed extra time, just to say what I wanted to say to him. And it was just so amazing. And also what gave me comfort was minister at the hospital. She would go and pray outside of Torry's room. So any faith, doesn't matter what faith you are, they asked me, like Christian, what have you. And so she would go outside of Torry's room and she would pray over him. And that gave me such comfort knowing that someone was there to, kind of do that for me. And in fact, if it wasn't for her, there was a one day where I could not get through to the hospital. The phone lines were down for whatever reason. So I couldn't call, they couldn't call me. And I thought, oh my gosh, the minister gave me her cell phone number. So that's how I got through and spoke to anybody to find out any updates about Torry that one day. Was she had given me her number. And so that was such a huge help. And And then I also dropped off pictures for Torry, and they put them in his room in the ICU. And I'm trying to think like all the different avenues that we did. Oh, and just because he like he was in a strange place with people doesn't know. He has no human touch. They even went as far as they got like the type of soap that he used at home, and that's what they would, so that he maybe would recognize the smell of the soap. And yeah, so, and then, once he came out of the ICU on, it was May 21st, he was brought to the medical floor. And then on May 30th, they opened up the visitation. So I was able to go and visit him for 2 hours a day, which was incredible. So I just couldn't wait to touch him. At first, the sign up, I was all PPE, and I took my gloves off, even though I was supposed to be wearing gloves, because I just wanted to touch his hands and let him feel like real skin to skin. Which, because he hadn't had that since March, it was 2 months, March 30th till May 30th. He didn't see any family or have human touch or anything. So I felt that was important.
And that is so important. And I think that part of this conversation needs to be everybody recognizes, right, the importance of having somebody with you, and Jonathan talked about it, people with you throughout your recovery. But right now, when the risks are just too high to keep patients safe, to keep visitors safe, it's not possible. And that's why we're having this conversation today.
Mm-hmm.
And Andrew, part of your role here is helping patients and caregivers make the most out of the opportunities that exist, not only to stay in touch, but also to play an active role in that care. In a minute, I do want to come to you and get some tips that you can share with caregivers. But
sure.
First, I do want to talk about what options people have to communicate with loved ones at Windsor Regional Hospital. And I want to introduce everyone to Amanda Lefrancois. She is a patient representative at the Olette campus, and she has a bit more right now on this new approach to visiting with patients.
So we do rely on our family members as much as we have before. Things just look a little bit differently.
There you go.
Wow.
There you are.
For now, we're utilizing virtual visitation options for people who want to keep connected to their loved ones in hospital. So the option would be for individuals to bring in their own devices so they can have their own iPad or phone present. Windsor Regional Hospital does have free Wi-Fi available to those people if they would like to stay connected. We also recently implemented virtual visitation assistants. They have just been outstanding, and we've been receiving a lot of feedback. If family members are interested in scheduling a time where they can FaceTime their loved ones, they can go to our website, click on the link, and schedule a time, and a virtual visitation assistant will be in touch with them. You do not have to be tech savvy in order to set up the virtual visitation meeting. The team members are specially trained to help you with any concerns that might arise during your meeting.
It's so nice to actually get to see your family's face. I think it really makes a difference.
During your virtual visit, the virtual visitation assistant will connect your loved one through an iPad and schedule a time so that you can both be available and have the conversation electronically. If your schedule is busy and you're just looking to send a note to a loved one in hospital, we do have e-cards that are free and can be delivered to all patients in hospital. An e-card is a note from yourself to your loved one in hospital to send your good wishes or to let them know that you are thinking about them while they're here and getting better. Again, please visit our website and fill out the assigned e-card, and a member of the team will bring it out to your family member for you. There also is the option for them to use the nursing team. You can reach out to the nursing station to ask for an update. We have to be mindful that confidentiality is an issue, and your family member would have to consent to information being provided to you at that time. But the nursing teams are aware how challenging things are right now for family members and are aware that it is important for them to be kept updated and to be kept aware as to how the loved ones are doing in hospital. If at any point there are any concerns or there's any questions that you might have and need clarification on, please feel free to reach out to the Patient Relations Department at Met Campus or Olette Campus. The extension is 52317 for Met and 34404 at Olette.
So a lot of great information there from Amanda. We are including links to a lot of that in the comment section below, so you can find that easily, including a link to the e-greeting, a link to request virtual visits. Those virtual visitation assistants are really busy right now helping people stay connected, and along with some additional information about patient representatives who are here to help. Now, Andrew, over to you now. I want to talk to you about how effective is this form of communication that we've been talking about in the absence of personal visits, which we all agree is ideal. How effective are these?
So thanks, Allison. And of course, I think we can all agree that an in-person visit would, of course, be the more preferred way for us to communicate, not only with our loved ones, but with the members of our care team, especially here through my work in the Cancer Center. One of the nice things about us shifting towards virtual communication and using some of these tools, such as the iPads, iPhones, or other smart devices, it's really allowed maybe more than one family member even to attend these appointments. So what we're seeing is that on the other end of the line, we do have not only the family member that maybe intended on coming to the appointment, but others that maybe wish that they could have joined, but couldn't do so in person and are able to do so by other means, especially those that may reside out of town or aren't able to get away from their other obligations during the day to be here. One of the things that we always recommend, and this is even when we're holding visits in person in a more traditional sense, is that we want families to really discuss this amongst one another, and even so much as identify or designate a point person to be the one to receive a lot of that communication. And that can just really improve on some of the efficiencies and the way that information is being shared and then distributed to the rest of the family. So we do have our own supply of devices as well through the Cancer Center here that we are lending out to family members that wish to be in attendance for our appointments, as well as those that even wish to check in on their loved ones while they're here in treatment, as we know that some of those appointments can extend to long hours during the day. So it has been, I think, maybe not so much the most preferred way of communication, but there have been a lot of positives and a lot of benefits in shifting towards virtual involvement.
And it is something that we're learning, right, as we go along. It's not something that really anybody had thought too much about maybe a year ago, but now it's growing. The demand for those virtual assistants is growing. And as Amanda said, you don't have to be tech savvy in order to make this connection. We have people here to help you. But what advice do you have for people to kind of help make that connection a little bit better? And even going through this today, we've run into some technical difficulties, which is a natural part of communicating this way. But do you have any advice in terms of how to make sure that you look good, that you sound good, and that you make the most out of these visits?
Absolutely. First and foremost, as we did today, enlist the support of those around you, the help. If you are of a family that has, younger members that are maybe perhaps a little more tech savvy or familiar with the technology that's being used, that's a great way that they can actually, maybe become more involved in the care as caregivers. In maybe not so much the traditional sense of providing physical or emotional care, but being there from a technological standpoint and being able to help that way. In all cases, the most important thing is to come prepared for the appointment by, putting together maybe a list of questions and really looking at identifying what the goal of that appointment is and what is there to be accomplished. What information is it that you're looking for or seeking that day, and tailor your questions accordingly to what it is that you might be looking for. Write them down so that they're not forgotten or missed, and maybe they may not come up as sequentially as you may have expected them to. But know that we're always here and willing to take the time or even schedule subsequent meetings if there's any need for some clarification around some of the subject matter. So definitely the importance of involving all family members and identifying who can do what and in what role and what capacity, and who has maybe certain abilities or knowledge that's can help in making the appointment go that much smoother. And then of course the importance of being prepared and coming with with a goal for that day of what it is that's going to be accomplished.
And a question for Jonathan. Amanda mentioned that patients are welcome to call and check in with the care team. Is there a best way to approach this? Andrew just talked about, being prepared for that, but is there a best time to call? Is there a frequency, amount of times that you can call?
Sorry, was that question for me?
I had addressed it to Jonathan, but if you have a
Hi. Yeah, maybe Andrew and I can both take a crack at it. I think that, one of the interesting things here is that the role of our care team in all of this has evolved as we've progressed through COVID, and we've learned a lot. And more, our clinical care team is trying to be that bridge between patients and their loved ones while they're in the hospital with us. And there's two types of flows of information, and Andrew touched on that. One is the information about the medical care that they're receiving, and then two is that emotional support that you're giving your loved ones while they're in hospital by having these virtual or phone visits. Our care teams are really working as hard as they can to make sure that clinical updates happen daily, whether it's between the physician or the nurse practitioner or one of our nursing team or one of the other allied team, that there's an update that happens. And what we usually encourage people to do is, in that first conversation that you're having when your loved one is first admitted, to have a conversation with the team about what type of information is really important for you to receive and how often you'd like to be contacted. And we work as hard as we can to accommodate everybody's preferences. For some people, daily updates are the best, and information about how they've eaten or how they slept is really important to them. And for other families, having more instrumental updates on a interval basis every other day, or ways that work for their family life and work life, is the better way to go, and it helps them stay connected in a really instrumental way. Andrew touched on a really good point too, that you have your questions written out in advance. I always do that myself, because once I sit down and start talking, it's easy to lose track of what you originally thought you wanted to ask. And so if you have a list, that helps make sure that you get everything covered off. But you can call and contact our nursing stations anytime. They'll always work with you. And even if they can't speak to you right at that moment, they'll make a plan to be able to get back to you. And that's been so helpful and so important. And the last kind of point to make there is that having a loved one in hospital under the best of times is extremely stressful. And as caregivers, we can experience stress. It can lead to burnout. Under COVID, those stresses and that risk for burnout is actually magnified. Even though you're not physically at the hospital, the amount of time and energy that you devote to worrying and dealing with the stress of being separated can have a huge impact on you as a caregiver. So these two things are avenues that as a caregiver you can control. You can control what kind of information you get and receive with your care team, and you can control the types of visits that you do still get to get. And to normalize that, video visits, although Amber said it may not be the same as in person, they've actually been wonderful for patients and families. They've been, and our nursing staff physicians have been moved to tears during some of these visits. They've given them an opportunity to learn so much more about the patients that we take care of. So they've truly been amazing things.
And I imagine it's changed the role of the care team a bit as well, because in addition to administering medical care, they were always there for emotional support. But now, when sometimes you're the only person that goes into that room, the only face that those visitors see, I'm sure that that's a different role as well.
100%. And the feedback that we've gotten from family members about this is that the gratitude for the nursing staff and any of our clinical team who are facilitating these visits is just, it can't be overstated. It makes such a difference for them. But for our teams to be able to see this, they're experiencing their patients and their families in a way that they haven't done before. And, there's silver linings in everything. And one of the silver linings here is that it's helped us learn so much more about our patients as people and their lives and the relationships that they have outside of the hospital and separate from the illness that they're struggling with. And that makes a difference in your journey.
I was talking to a nurse up on one of the floors just this week, and she was talking about how fun it is to watch when you bring that iPad in and you see, somebody seeing their grandchild at home, or, seeing the Christmas tree. And that's an experience that they wouldn't necessarily have in the hospital with visitors there. And that there is a different, something really nice about this experience as well.
And with family members from a distance too, right? Like this broken down barriers for people who live in other cities or other countries or in other time zones.
I have a question for Heidi now. You did touch upon how important those relationships were that you had with Torry's care team. Do you have any advice for other people who are building those relationships and how to prepare for those conversations and develop those relationships?
I think that like the nursing teams and doctors that Torry had were all phenomenal. And I think it's really important, like Jonathan and Andrew touched on, being prepared for the phone calls. I noticed with Torry, because I would call and ask for updates and get all the details, that the first couple weeks that he was in ICU, if I would call back after they'd given me some information or some numbers of settings or things like that, by the time I got to the next phone call, I forgot everything. And then I didn't even remember what to follow up on. So being prepared with your questions, and everything that the nurses and doctors would say, I got a little logbook and I would write everything down. I would write the date, the nurse's name, and just, all the details that they gave me, so that when I followed up the next time, I could look back and see what was, reported the other conversation. And I think that as the caregiver for your patient that's in the hospital is just having a lot of patience. All the nurses and the doctors, they were so busy and caring for everybody, not just your own family member. So understanding that, they're there caring for many people, and just to have patience and understanding that if they can't come to the phone when you call, that it's not, the end of the world. They're just busy. And a lot of times I would call and, the person that answered the phone said, "Oh, your nurse is in with Torry right now." And at the first few times I kind of panicked. I'm like, is he okay? Like, what's wrong? And over time, I just learned that, sometimes they're in there with him, whether they were proning him or what have you. Certain things take a long time, and just to have patience. And they usually would give me like a time to call back. So, and sometimes when I did call back, they still weren't available. And it's hard to, being on the other end, not getting that update. But I learned to just be very understanding from where they're coming from and the stress and pressures that they're under, and just to wait until they have the time to give me the update. So, and they were honestly all phenomenal.
And that's such great advice, and recognizing that everyone's busy. I have a good friend who has a family member in the hospital right now, and she said it's tough because, she's got 5 brothers and sisters, and so, one of them makes the call every day or whenever, but it's tough not to also check in and be the one to want to get that information.
Yeah, I was the main, obviously the point of contact for Torry as well. And then I would get the update, and then I would write a text and send it to all the family members, and I would just copy and send the same update to everybody all the time. So everyone always had the same update and just kept everybody informed. That seemed to work.
Now, I was talking earlier with Jonathan about sometimes, when you're visiting with somebody, you're not talking at all. It's just important just to be there. So sometimes when you're making these connections, did you ever was it just a silent connection, just to have that open line?
Like in talking with the nurses at the hospital,
or Torry?
Yeah. Yeah, well, because for Torry, he was in the ICU for the 7 weeks out of the, 2 months or so that I couldn't actually physically be there. So it was just a one-way conversation most of the time, me talking to him, giving him encouragement, and, reminding him to just keep fighting, stay positive. He was so sick and so near death, but I would never have let him know that. But just, praying and staying positive and having the patience, those were the main things. And I just, words of encouragement always, even the recording on the teddy bear was all words of encouragement, and just reminding him that, his family loves him and to keep pushing.
And one of the other pieces of advice that I have heard from people, if because holding your communication device, it can get heavy, or, it's not always comfortable, but they also have stands that you can have so that you can just have it there and have that open line of communication without kind of feeling that you have a device with you.
Mm-hmm.
Now, so far in this conversation, we've covered communication mostly within the hospital and with hospital patients, but this past year with so many people in isolation, so many people at home with no visitors, a lot of these virtual visit tips are equally as important. And I want to introduce another voice here, a familiar voice if you've joined us before. And earlier we met June Muir. She's the CEO at the Unemployed Help Center. We're going to see a video right now. And in this video, she talks about her role as a caregiver for her husband while they were both at home and she herself had the virus, and also the importance of the role of friends and others throughout this recovery when they couldn't be there in person.
I had to care for my husband while I had COVID, and I was still very ill. And not having that family support as far as allowing them in the home to help you was very difficult. And what is more difficult is when you see your loved one failing, you're the caregiver, you're trying to make those decisions as far as, do I call 911, send my husband to hospital, or do I take care of him at home? And I found the hardest thing for me was knowing in my heart that I should have called 911 for my husband, but I didn't because he asked me not to, that he wanted to stay home with me. He was afraid to leave me. He didn't want to leave me alone, and that maybe we wouldn't see each other again. We went through Mother's Day, Easter. We had front window visits. I think that's what kept me going, was those front window visits.
I didn't really want to leave June, to be quite honest. June had COVID herself. And if I really felt that if I left her, it would put even more stress on her. The fact that she wouldn't be able to visit me would be, terrible in her eyes. And I really had a great fear that I may not come out. Well, the isolation is terrible. I mean, we went through virtually 3 months that we were here by ourselves. And it was really only through the grace of God that we had our such good friends and family. As far as both of us being sick at the same time, really, I didn't care for June. June cared for me, to be really candid. I'm one of those whiny guys that can't look after himself very well. And it's really through June being my caregiver, that I was really able to get through it.
Worried about how she was going to be able to, be taken care of in terms of being fed and just daily tasks. And then once he was diagnosed with COVID, it was, even more worry, because how are they both going to be able to take care of themselves and each other? And I wasn't physically able to be there with them. So, just seeing two people who are so strong in that state was really heartbreaking for me. And I felt like I really couldn't do anything about it. The time when they really needed me most, I wasn't really able to be there. So I tried to do, their grocery shopping and just dropping it off at the door. Phone calls, at the beginning, the first month or two was difficult, just because I remember my mom having this cough that seemed to linger for, months. And so it was hard for her to actually speak to me on the phone. She would cough every sentence or so. So it was really hard to talk on the phone. And then we would do window visits once they gained their strength back. So that helped, but it doesn't replace the physical interaction.
So June, it sounds like you really also nailed the role of the caregiver there. Your husband sounds very appreciative for the care that you were able to give him while trying to recover from this virus yourself, but also to your daughter, because I'm sure listening to her there, I'm thinking you want to make her think that you're okay. You want to communicate to her that you're okay. What advice do you have for people I know, and even after those 3 months were up and you were just talking about, Christmas, a lot of it was done virtually. What have you learned over the past 10, 11 months that you can share with others in terms of making the most out of this situation?
So the one thing that I've learned is that when you're at home taking care of someone, make sure you call the drugstore and you get a thermometer in the house, you get Tylenol in the house. Our pharmacist suggested vitamin D, vitamin C. I had none of those things in the house. We're pretty healthy, and I was like, okay, I'll order it. I'll get them here. And also reaching out to friends and making sure that they bring you the essentials that you need. You need a lot of help. I was home for 3 months. I had symptoms, so we couldn't let anybody in. And it was just so difficult. And when I listened to Bill speak, it gets to me, and I get teary-eyed too, because he was extremely sick. His fever wouldn't go away. He had diarrhea. He had problems with eating, his stomach. He was dehydrated. So I just kept trying to pump those fluids in. But what's hard is when you're ill and you're not well and you're trying to look after someone. So I've learned that you've got to have a supply in your house. of what you need, and that you really need to rely on your friends. Don't hesitate to pick that phone up and call someone.
And Heidi, same question to you, because it sounds like you went through something similar, not necessarily taking care of Torry in your home, but trying to cope with what was going on in this situation and really not being able to invite anybody into your home or to be there with you, because at the time it's not safe to do so. What advice do you have for people in that situation?
Yeah, I was in sort of a similar situation. I had COVID as well, same time as Torry. My fever started a few days later, but I was caring for him at the same time, trying to keep everything bleached and sanitized in the house as well. And I sent my daughter to stay with my sister, and my other daughter stayed in her room downstairs. So the isolation was pretty difficult. And our neighbors, they were always, willing to help us with anything that we needed, and a lot of friends and family and people would, send food over, do any sort of groceries that we may have needed, and just having good support system around, keeping my spirits up, because it was such an unknown. Early on, it was so new for everybody, and like I said, everything that you read online or in the news was so doom and gloom that I just turned all that off, and I tried to keep myself busy. But sometimes I would go, like once Torry was at the hospital, I would go from, like the bed to the couch to the bed. I was not productive at all, but I had good people around, and, kept belief in that things would get better. And, took a really long time, but Torry's alive and home. And I just, even now caring for him, I am his caregiver. And even when he was, transferred to the rehab hospital, I was his caregiver there as well. And I participated in some of his therapies. And I've learned so much that like he does speech therapy, he does occupational therapy, he does neurophysiotherapy because of the brain damage he suffered. And I'm learning so much. So here in the home, there's different activities that we do that help in his progress as well. And I just keep telling him, like what a warrior he is, and that he is going to, make it back to his health one day, and just to give it time. And it is very, you have to be organized when you're a caregiver for his appointments. I have a big desk calendar. I write everything down, and the OT therapist has encouraged him to, remember his own appointments and things of that nature. So I think being organized as a caregiver will help you go a long way as well. That's what I found has helped me, and staying on a schedule. So I try to kind of keep the same normalcy and schedule for Torry. And a lot of things are hard, like his speech OT is done over Zoom as well now. Just the neurophysio, we go in person, just with everything that's going on in the lockdowns. But it is a huge adjustment, but you just have to stay positive and keep pushing forward is what I tell myself and would encourage everybody else to do as well.
It sounds like a huge adjustment. And we didn't mention this, but Torry, you were a nurse, or you are a nurse. And so you probably are not used to being in this role. You're used to being in the role of a caregiver, but it sounds like she's doing a pretty good job. Yeah. So I think that we're coming to almost the end of our conversation. What I would like to do, though, before we wrap up, is go around the circle here and see if anybody has any last words of advice for people who are at home or who are in the hospital, really looking to strengthen the connections that they have with their loved ones or with care teams. So, Andrew, let's start with you.
Okay, thanks, Allison. And this is kind of going off of a little bit of what Jonathan alluded to, as well as Heidi, you as well. The importance of being specific, and not only being specific in terms of voicing your expectations with your care team, your family members, but being specific and asking for help. Too often, we all have been in that position where we've run into an old friend and we've, decided, or agreed to meet for coffee one day, but it never happens because the date was never set. A time was never committed upon, and it just kind of falls by the wayside. So, one thing I can recommend is, or suggest is, be very specific in your expectations and specific in what your needs are when asking for help from those around you, from your supports, from your nurses, your care team. Because if the more specific you can be, then of course the more able we are to then fulfill and meet those expectations. So if that's one word of advice, I think that's certainly important.
Great. Thanks, Andrew. Jonathan, over to you.
Just to stem off of what everybody said, and June in particular, that for caregivers to take care of themselves is more important than it ever was. You're only as good to your loved ones as you are to yourself. And if you're not doing well, if you're not sleeping and eating and getting regular exercise or have a regular routine, it really diminishes how well you can function for the person that you're trying to support as well. So you have to take as good care of yourself as you are for your loved one.
Great. June?
I just want to touch on the fact that it's almost a year in March since I was diagnosed with COVID, and I'm still having those window visits with the grandchildren, and we're still only going to the grocery store. I'm at work because we are deemed an essential service here. But really, for Bill and I, we just want to make sure we follow those guidelines, and just so appreciate hearing from Torry and Heidi today. That just enforces that, we need to listen to the guidelines and have those window visits, see our grandkids by Zoom. So it's difficult, but it's just something we have to do.
Absolutely. Thanks, June. And last word over to Heidi and Torry today.
Well, I just, having gone through this was something I would have never imagined in my life. But I just think that you have to stay positive and, trust in the nurses, the doctors, the therapists, all the staff at the hospitals. They are there to care for your loved one, and they do a phenomenal job. And like I said before, just having a lot of patience. I call it my 4 Ps. Patience, positivity, prayers, and perseverance. You just have to keep pushing through. And I recently, a woman that the mother of a girl that played basketball with my older daughter, her husband is currently in the ICU. He just recently got off the ventilator, but when he first went on, she reached out to me like almost complete stranger, and we've become like close now because we both, she leaned on me for advice, and I would give her different ideas of what she could, ask the doctors or ask the nurses, or how she could communicate with her husband. And we've gotten really close over that. And I was happy I could be there for her because, at first when I was going through this with Torry, I didn't have anybody to ask, why am I feeling this way? What should I ask? What do I say to the doctors? I am not, Torry's the nurse, he was our medical person in the family. I'm not medical at all. So half the time I didn't even know what to ask or what was good numbers. So having people to lean on is wonderful. And if anybody, out there that needs somebody to talk to, feel free to look me up, and I would gladly help support anyone through any of this.
Thank you so much. Thank you for sharing your story. And June as well has said that before, and that's why we do this. So people know that whatever you're feeling, it may feel like you're going through it alone, but you're not. There are people out there who understand, and thank you so much. It's important to have these stories out there. A few thanks before we wrap it up for the day. The Windsor Regional Hospital Foundation would like to thank the donors from Transition to Betterness, the Zuckelman Foundation, Jasmine JC, Windsor Port Authority, and Sterling Fuels for the generous donations of iPads. And those iPads, like we've talked about today, are so important to our patients and our families at Windsor Regional during these visitor restrictions. Thanks to all of you again, Heidi, Torry, June, Jonathan, Andrew. Thank you so much for being part of this conversation today. And thank you to all of you at home who joined us, everyone who sent their love and their thumbs up and supporting us throughout this. We are back next week with another webcast, Coping with COVID. This time we're talking about coping with COVID from the front lines. So those who are working in our hospitals, how this pandemic is affecting them while they're trying to balance the added pressures at work, the increased demands, the emotional toll with everything that's going on at home and all the changes of this past year. And we all know they have been pretty significant. So look forward to chatting with all of you again next week. And in the meantime, please, everybody, stay safe. Cheers.
Thank you.
Thank you.